Okay, so I'm going to take you through a simple routine that has served me well. So you want to have the patient have a gown on, make sure that their shoulders are exposed because you're going to be working on the anterior, lateral, and posterior area and the facial area. So I like to start with just working the anterior pectoral major and minor area. Then I like to get here at the superior aspect of the clavicle here. You have many, your scalenes connect down here, and this place can be a commonly tender area. Now your touch should be therapeutic, meaning it is having an impact on reducing and stretching the muscle, reducing tone and stretching the muscle, but not such that the patient is grimacing and they are uncomfortable. And how do you know that? Just watch their body language. Okay, same on the other side. We've done some pectoral work here, and then I'll do some work on the superior aspect of the clavicle. Okay. And I already noticed she is tighter on her right side than her left. All right, now I'll put her into a little bit of left rotation and kind of work along the anterior aspect of the neck using my fingertips. You can even grab the sternocleidomastoid muscle and just kind of loosen it up. You know, grab it like a garden hose and just do a little circular motion here. Again, these muscles will pull you into a forward head posture if they're too short. Then I'll go into the mylohyoid area. So this is just inferior to the mandible. Be a little bit careful. Sometimes this can be pretty sensitive, especially as you go around the angle of the mandible here. So don't be too aggressive. Then you can come up into the masseter and just make your way up, right up into the temporalis muscle, all the way up to the apex of the skull. Okay. Also consider the sinus area. This area can also you can do basically a release to the sinuses by going along here just below the zygomatic arch. And right up into the skull here. Always traction is great. I will take my hand and just cradle her head, and then I'll take my fingertips at the frontal area, and simultaneously I will distract and let my fingertips slide to the apex of the skull. Good. Now these techniques, you can use two hands. You can do both on each side, which often for time's sake I will do both sides at once. Good.